ironic that opioids, which are the most powerful painkillers that we have available, would actually cause increased pain for people who have taken them for a while, so chronic or long-term use. But that seems to be the situation. It's technically named hyperalgesia, or increased pain, or the full term is opioid-induced hyperalgesia. And it was first described about 1890 by both a German doctor and a British doctor who early on, when opioids had really started becoming prescribed and used for patients, just noticed that some people who had been on them for a while were actually having more pain than when they started. So the doctors were like, how is this possible that opioids that are supposed to relieve pain are actually increasing the pain? And now there's been lots of animal studies showing that this happens, and it tends to happen fairly quickly, often after only a couple of weeks of chronic opioid use. The pain actually gets worse. We see this a lot with our chronic pain patients. They come in for detox because the pain medicines aren't working anymore. They're still in pain. They're in pain all day long. And there's often an hour or two where the pain medicine goes into their system, but then it starts wearing off and they feel more pain. And they've often been on it for years. We've had patients who have been on opioids for 25 years. We had an 82-year-old in the other day with neuropathy, and she'd been on pain medicines for 25 years, and she was miserable. Her pain was worse, and she wasn't getting any real relief, and her quality of life was horrible. Why would this happen? It happens for a couple of reasons. One, tolerance builds up so that once the body starts getting opioids, it needs more and more to do the same thing because the body adjusts to it and it stops making its own natural endorphins. So typically when we detox people and get people off the opioids and put them on naltrexone, which blocks the opioid receptors and helps the brain go back to normal, then their tolerance comes back down and the brain starts making its own natural endorphins. So then the pain actually lessens. But the biggest effect is that the opioids themselves seem to cause a decrease in pain threshold. And what we mean by that is that our brain is constantly evaluating how much pain are we in. We all have arthritis in the back, and we have muscles and bones that are constantly sending messages to the brain that let them know that it kind of hurts a little bit. Life is kind of painful. And the brain sort of puts that in the category, well, it's not a panic, there's nothing really wrong, I don't need to do anything about it. So you're not even aware that it's going on. But opioids make that pain threshold lower so that every little thing starts feeling like pain. And one of the studies we do is called the ice bucket test, where you actually have somebody stick their hand in an ice bucket and you see how long they can hold it for. And I think the number is usually about 45 seconds that a normal person can do that. But somebody who's on Percocet chronically, they can usually only keep it in for half that time, about 25 seconds. And so they're actually feeling essentially double the amount of pain that a normal person is, even though they're on painkillers. And that seems to be what explains this opioid-induced hyperalgesia. They're actually feeling more pain on a regular basis. That's physical pain, but it's also emotional pain, so that they're always feeling a bit more irritable and a bit more grumpy and a little bit, more depressed and more anxious, so it's just kind of miserable. And that's why when we're able to take people off their chronic opioids that aren't working for them anymore, 95 times out of 100, within a week or 2 weeks at the most, they're saying, boy, my pain is much less and my quality of life is much higher because they've gotten off the opioids and let their body go back to normal.